we making the same mistakes with bird flu that we did with the COVID-19 pandemic? Hi, everyone. I'm Dr. Omar Awan. I'm a physician, senior public health contributor for Forbes, and a MedPage Today columnist. I'm going to answer that question and tell you 4 reasons why I believe the United States is making and mirroring the same mistakes with bird flu as it did with the COVID-19 pandemic. Before I begin, I just want to say that the bird flu has been around for a while. It's been around since 1997. We've only recently had human cases starting in April the 1st. And now we've had 66 confirmed cases. And now we know that one person, unfortunately, died in Louisiana from the bird flu. So, what mistakes are we making that are very similar to the mistakes that we made in the COVID-19 pandemic? Well, the first is that we're not testing enough. 66 cases have been confirmed, but there are likely many more cases that we haven't found out about. And many farmers have likely been asymptomatic, have not been tested. And many farmers are actually reluctant to get tested because they don't want to give up the money that they're receiving, the revenue from the products that they're selling, and they don't want to be associated or have the stigma of having the bird flu. Well, why is that a big deal if they're asymptomatic? Well, if we don't test, then we have no idea about the virus. We have no idea about how severe the cases are. We have no idea what the prevalence is, how serious the virus is, and we have no idea how to contain it and how to treat it appropriately. And that's exactly what happened with the COVID-19 pandemic back in January of 2020 when we weren't testing enough and we didn't know how severe this was. So this is a major problem. It's like we're walking in the dark blind because we don't know what we're doing. The second mistake we're making is that we're avoiding early warning signs. 66 people have already been infected with bird flu. One person has already died. This is very similar to what happened in COVID-19 when in January, the CDC said that the risk to the public was low, but yet thousands of people were getting infected and dying. And then eventually in March or April, we had this hysteria of lockdowns, mask mandates, and all that stuff that you remember that wasn't good. Instead of being reactionary about it, why can't we be proactive and administer vaccines to those that need it the most, like farmers? I'm not saying to vaccinate everyone, but we should vaccinate farmers at the very least so that they don't get infected and they don't get sick, and certainly they don't die. Vaccines have already been rolled out in Finland, and vaccines are available to target H5N1. It may not target the exact strain that's circulating here, but vaccines would offer some level of protection against the bird flu. The third mistake that we're making is we're not investing enough research and resources. And what I mean by that is take Tamiflu, for example, which is an antiviral medication that is known to be effective at treating both the common flu and the bird flu, thankfully. But why haven't we invested in research to develop a monoclonal antibody that specifically targets the bird flu? That should already be made by now, given that there have been months, almost a year, since human cases have been reported here in America. The other thing is that President-elect Donald Trump has said that he may withdraw support from the WHO, the World Health Organization. And we know that global collaboration is necessary to contain something like the bird flu. We need to be talking to other countries to see what they're doing, how they develop vaccines, etc. Without that support, it will be very hard to control the bird flu. And this is precisely what we did in May of 2020. We withdrew from the WHO. The fourth and final mistake we're making is that misinformation is soaring. There is so much misinformation about these vaccines, about COVID-19 and the bird flu. Remember, misinformation derailed efforts during COVID-19 to get people to get vaccinated, to wear masks, etc. The politicization of vaccines, the lack of trust in the public with science, all decreased vaccination rates. I mean, even if you look at the boosters this past year, only a little bit more than 20% of adults that were supposed to get the COVID vaccine got it. A little bit more than 40% of people have gotten the flu vaccine. These rates are very low. And if we were ever need a bird flu vaccine, I'm not sure we need it right now, but if we were to ever need it, I'm not sure people would actually get vaccinated because there's so much misinformation out there. And we've done nothing to target anti-science. Why has it been 4 or 5 years since the COVID-19 pandemic and we don't have a plan to target anti-science and how to deal with it? This is going to be a problem if something happens in the future. So there you have it. These are 4 important reasons why we're mirroring the same mistakes we did with the bird flu as we did with COVID-19. Hope that was helpful. Please subscribe to the MedEd page. And as always, please be kind to yourself and to those around you.